Ladies and gentlemen, please welcome the president of the NAHC, Bill Dombi.
Good morning, everyone. Good morning. Thanks for joining us once again in beautiful Long Beach. It's also a long walk to get here, understandably so. I'm looking for a golf cart, but I can't find one anywhere. So hopefully we'll be able to get you back safe and sound as well to the convention center. I have the privilege of opening up this morning's session. I've been given a complete long leash. They said, talk whatever you want to talk about. Actually, when I say they, I said that because I'm now the president of the association. I can give myself that authority. And thank you. So I'm trying something different. Those of you who've heard me speak before know, one, I can speak endlessly. No periods, no commas, nothing at all in terms of slowing down. But beyond that, I usually speak about what I do from an expertise standpoint, whether it be Congress or lawsuits and the like. But I'm trying to give a little bit different today, and it's the state of the union, the state of the industry, the state of what you're all about there. And I thought back to a time in a conversation with Val where we talked about one particular thing. He said something that I hadn't even noticed was happening. He said, you rarely say the word I. You always use we. And I don't know how that happened. I'll credit my upbringing for that, the fact that I was with 3 other children and such. We lived in a small house together with our 2 parents throughout, and so the we was necessary. We need the bathroom, kind of thing. So we're going to talk about what I call the power of we. And in this part of the address, I want to talk about the present and the future forecast for home care and hospice. And I submit we are as strong today as we have ever been. We've never also had a better future. I mean, home care is now woven into the very fabric of health care. It's known, it's respected by the public at large, by healthcare professionals, politicians, and policymakers, everybody. When you take your flight home from this conference, someone asks you what you do, and you say, I work in home care hospice, you know what they're going to say. Oh, we love what you do. There is such an incredible warmth that you all bring that is so embraced by me. In just a few years, home care and hospice has transformed healthcare and the healthcare industry at large. You were intruders into the institutional part of healthcare. You are now in the center of it. Home care has become the preferred care setting for clinical, economic, and for patient-centered satisfaction. By all metrics, we've not only arrived, but we've supplanted the so-called continuum of care with a breadth of service that's comprehensive, technologically advanced, and patient-centered. Today, home care and hospice is a $130 billion a year industry led by 12,000 home health agencies, 4,000 plus hospices, and nearly 15,000 personal care, private duty, and infusion therapy providers. We've arrived, and we're growing every year. But we're so much more. And why? That's where I get to the power of we. Now, I've enjoyed music for many, many years, particularly pretty much every form of rock music. And given that NAC lives in the land of metaphors, Washington, D.C., I have to offer some metaphors that fit with the we references from some of the songs you heard on the way in. Now, some of you might have heard part of the song for Tommy. That comes from Pete Townsend and The Who, where the line that I wanted to focus on is, we're not going to take it. Where does that fit? Well, warning to you at CMS, warning to you at Medicaid, at managed care companies, anybody else who gets in our way, healthcare providers, otherwise, we're not going to take it. We're not going to be bullied. We're not going to be pushed aside. We're not going to be ignored. We're just simply not going to take it. Some of you also walked in to Queen, We Will Rock You. Frankly, I was never a big Queen fan, but it was just a great line because I think that's where the industry is going, is we will rock everybody. And then finally, a song that didn't get up there, and I'm so happy maybe it didn't, because someone who might have asked for Michael Jackson and everybody else that joined him for We Are the World. I mean, we do believe that we are the solution for home care services out there. So, if you didn't like my metaphors, I'm sorry. I'm sure we can come up with a whole bunch of more we's, but I just like those myself. So each fit into what we are in home care and hospice. Home care is taking over health care. We are the world. Queen, we've just gotten started. We're going to rock you. And who? We're not going to be bullied. Well, what else are we now, and what will we be in the future? Let's start with the following. We, and you're going to hear the word a lot, we provide care to 14 million people every year. We travel 8 billion miles every year through all kinds of terrain to meet the needs of the most vulnerable people in society. From the 405, which might be the most dangerous terrain that we could take on the West Coast, to the mountain passes in Montana, to the islands in the Maine coast. Yes, on lobster boats, home care is delivered on a daily basis. And to the Delta, Mississippi. And if you've never been to the Delta, Mississippi, here's some context. The nearest McDonald's from most places in the Delta is at least 25 miles away. You know, McDonald's really is the GPS for most of us. We do it after the floods in Houston. We provide care following the wrath of Irma in the southeast, and now the fires in Santa Rosa in California here. We meet the needs of children, adults with disabilities, and seniors every day with unrivaled quality, unsurpassed patient satisfaction, and a cost effectiveness that is now dynamic. We are 2 million caregivers working in an integrated and collaborative way with the patient, physicians, hospitals, family members in a fully holistic manner. We understand that housing and diet matter as much to an individual's health as pharmaceuticals and direct hands-on care. We're nurses, we're therapists, we're social workers, we're technicians, along with accountants, lawyers, and administrative personnel. We have to have lawyers in there, don't we? At least one. We're driven by a passion for caring that knows no bounds and can overcome every obstacle and every barrier. We're a community connected together with a common purpose and a common spirit. We know that home care is about care, not paperwork, not arbitrary administrative burdens or gotcha oversight and endless payment cuts by stubborn bureaucrats. I'll stop for a moment. When I went through that line with my wife, she said, "Could you replace the word ignorant with something else?" It's no offense to the bureaucrats, you deserved it. It's just stubbornness we have to deal with. But we're not as naive to believe that it will go away. We've been in this business a long time. We know that as government payment recipients, there's going to be paperwork, there's going to be administrative burdens, and there will be wrongful decisions too. So we will fight. We will fight for our patients. We will fight for our businesses. We will fight for the cause of home care in any forum, in every forum that we need at any time. We'll take the fight to Congress, to state legislatures, to governors, and to the President of the United States when needed. Donald Trump, watch out for home care. And we will fight all the way to the U.S. Supreme Court if needed, as we have in the past, for the purpose of gaining fair access to home care services. And for those of you who may remember that, back in 2005 and in 2007, we went there twice and we won both times. We will continue to fight wherever necessary, but we're willing to take a step back if it allows us to take 2 steps forward. We've taken the simple idea of care in the home and have transformed it to a high-touch, high-tech service recognized and admired by all. We are the solution that healthcare needs more today than ever. And we are far from finished in advancing care in the home. We're going to continue to harness the power of we. We know that together we're so much stronger. Healthcare is in the midst of a transformation from volume to value. It's about time. We've been there for a long time. You know, home care is the perfect fit for value-driven patient outcomes. Now, NAC is also undergoing a transformation that connects with the power of we, because we see the future of NAC as one built on an ownership culture, one where members are the owners of this association. We see NAC as a recognition that we are all in this crusade together. We are providers, we are caregivers, we are business support partners in the exhibit hall. We're state associations, we're the NAC board and the NAC staff. We are in this together. We must speak with a common, unified message in all of our advocacy efforts, in all of our communications throughout. A unified we will succeed. A divided home care will fail. We must strengthen our voice, maximize it through coordinated, massive numbers of caregivers and those who receive care with a grassroots power that will not be rivaled in any other healthcare sector. We at NAC will be engineering a campaign with you joining employers and employees, patients and their families into an advocacy force that will channel our passion and our messages to Washington and through state capitals across the country. If the NRA is considered the strongest grassroots advocacy organization in Washington, watch out, we're going to be even stronger. We will use social media, emails, phone calls, and we will have direct visits to our representatives in Congress and in the states. With that force, they will listen to our voices, the voices of home care, and know the consequences if they don't in the next election. We together have that power, but it's going to take hard work. It's going to take perseverance. It's going to take patience and resources and creativity. But I've known you all for 40 years, and we know that that's what home care is made of. It's the reason why we came from being confused with Home Depot to where we are today, where everybody knows what you do and admire it. We'll succeed because we will do it together. So on behalf of NAC, the great staff that we have at NAC, the team, those operating with a we format within NAC, for all of you who are members of the association and all of those who will be members of the organization, for the board, for everyone else, I just wanted to thank you for coming here. But more than anything, thank you for being part of home care and hospice.